Today we'll discuss a terrifying incident that gripped the Owen family. In 2021, Isabella Owen, a little toddler from Hartlepool, had just turned 3. She was happy, full of life, and cheerful, just like any other tiny tot. Everything was great in the Owen family, but in early August, Isabella had a bit of a cold. At least, that's what her parents, Rob and Amy Owen, thought. Then a strange thing happened. Isabella started snoring and had terrible breath. Amy suspected her daughter had hay fever and took her to a doctor, but it was dismissed as nasal polyps. Isabella's mother's intuition kicked in when things started getting worse. What happened next was nothing less than a horror movie. Isabella's parents were terrified to see their daughter going through something they were unsure of. They raced to James Cook University Hospital to get clarity on Isabella's health status. The doctors assessed her and asked the family to rush to Newcastle's RVI. On August 27, 2021, Isabella's family got the most crushing news of their lives. Isabella was infected with nasopharyngeal cancer, a rare soft tissue cancer. This diagnosis was not on the family's radar. Let's first talk about the severity of this cancer. The nasopharynx is the uppermost part of the throat. The throat muscles mingle with each other to form this hollow tube-like structure. It lies just behind your nose and just above the roof of the mouth. The nasopharynx is the most crucial part of your windpipe as it allows the passage of air from your nose to the lungs. Nasopharyngeal cancer affects the cells of the nasal cavity and the throat. The nasal cells can divide uncontrollably and destroy adjacent tissues. It affects more teens than children. Nasopharyngeal cancer has a low incidence too. It impacts 1 in every 100,000 people every year. What causes this cancer? Being infected by the Epstein-barr virus or having a strong family history of nasopharyngeal cancer increases the child's risk of getting it. This cancer generally starts as a mild headache, blocked or stuffy nose, and nosebleeds. Amy had observed these symptoms in Isabella. After this stage, cancer flares up, causing earaches, infections, difficulty speaking, and lumps in the nasal and oral passage. Since the doctors had detected Isabella's cancer quite early, it had not aggressively spread to other parts. That means it was treatable. This piece of news was a massive relief for the family. Nasopharyngeal cancer in children is notorious for spreading rapidly to the bones, lungs, and liver. The tumors that form after the cancer cells spread are called metastatic tumors. The other name is secondaries. Most commonly, these secondaries of nasopharyngeal cancer lie in the lungs. That does not cause a person to have lung cancer per se. In that case, cancer gets labeled as metastatic nasopharyngeal cancer. The doctors carried out tests to confirm the spread of cancer, a procedure called cancer staging. They first conduct a detailed neurological exam to check if the brain, spinal cord, muscle reflexes, and other sensory organs are normal and to rule out high risk. Doctors may also do chest x-rays as the nasopharyngeal cells are near the chest, or CT scans. They also inject a contrast dye to see internal organs more clearly on the scan. A PET scan allows better and brighter visualization of tissues. Most times, when children report to the hospital when the cancer is already in the advanced stage, the doctors can do very little. Fortunately, Isabella had time on her side. The doctors had to thoughtfully choose a cancer treatment. The usual treatment options are chemotherapy, radiation therapy, surgery, and immunotherapy. Before we go ahead, let's discuss these in short. Chemotherapy is when a bunch of potent cells or drugs are injected to stop the rapid growth of cancer cells. Having these medicines via mouth can also control the division of cancer cells. Radiation therapy uses supersaturated X-ray beams to kill the cancer cells. The high-energy rays are emitted through an external device and focus directly on the affected area. This method can be technique-sensitive, as concentrating the beam on healthy cells can have adverse effects. The next option was surgery, which involved the severing of the overgrown tissues. The surgical intervention needed to be precise since the location of Isabella's cancer was crucial. A little surgical deviation could affect the healthy part of the windpipe. That's why this radical method was the last option. The next, most promising treatment was immunotherapy. In simple terms, this treatment boosts the natural immunity of the patient. It is a biotherapy and restores the body's natural defense against cancer. By this time, the doctors noticed a small mass of cancerous cells already hanging out of Isabella's nose. It was very tiny and never crossed Amy's mind to be cancer. They soon fitted Isabella with a breathing tube to allow unrestricted breathing. Amy also recalls the tumor dangling at the back of Isabella's throat. This lump obstructed the windpipe while the little girl slept, which made her snore. A nasal tube was inserted through her nose to ease her breathing and reduce her snoring. Isabella also got significant relief from obstructive sleep apnea, which had developed over months. Sleep apnea is a medical disorder that causes fragmented sleep due to restricted breathing. It not only wreaks havoc on your sleep cycle, but also causes fatigue, exertion, and drowsiness, and increases your risk of heart attack and stroke. The rapidly growing cancer had enlarged so much that once Isabella even coughed up half the tumor. The scene looked straight out of a horror movie. Seeing a child in excruciating pain can be a living hell for any parent. The disease currently has a 38% survival rate in children. That's why, without any further delay, the Owens began treatment. The doctors started chemotherapy for Isabella. She was on aesthetics 5 days a week for 6 weeks. Chemotherapy has some drastic and long-lasting effects, even on adults. It can make your body fragile and alter the ability to walk and talk overnight. But this grueling treatment could not dampen Isabella's spirits. She was only sad when she had tubes in her hand, but once they came off, she ran around the ward as if nothing had changed. She even had to travel to Manchester for intensive radiotherapy. This helped shrink the cancerous cells and caused scabby congestion on her nose. It also caused a mild long-term redness. After enduring one of the most painful treatments in the medical world, the kid was still full of positivity. Even the worst side effects like hair loss didn't matter to her. Extensive radiation had increased Isabella's risk of skin cancer. Her parents must now be cautious of protecting her from harsh sun rays and dabbing sunscreen every time they step out. The scariest thing about childhood nasopharyngeal cancer is that it does not respond to treatment and has a significant chance of returning. With this fear in their minds, Isabella's parents took her for a screening after a few months of therapy. But guess what? Her most recent MRI shows no visible tumors. She's entirely cancer-free. Isabella had been a mighty little warrior. Check out this TikTok video her mother posted after her recovery. Her parents want to share her story with every family battling childhood cancer. They also want to be positive, as Isabella will be getting a little brother in October. Isabella is still on maintenance therapy but experiences more freedom now. She continues living a near-normal life with a Hickman on her chest. Struggling for 7 months to get Isabella in and out of the hospital was emotionally, physically, and financially taxing for her family. Driving 40 miles every day to reach the hospital exhausted their resources. The food, gas, parking, medical visits, medicines, and treatment took a significant share of their savings. Isabella will soon be having another birthday and wishes for you to stay at CBeebies Land Hotel, go to Peppa Pig Land, and explore other places which she would have done without cancer in the past months. Rob and Amy are trying hard to give her a second chance to enjoy life and appreciate her for the true warrior she has been. That's why they've set up a fundraiser to help pay for all the activities she missed due to cancer. To donate to Isabella, visit the link in the description box. About 1.6 million people in the US, like Isabella, get diagnosed with different cancers every year. It would help if you were very careful of what you eat, as an unhealthy diet can be the primary fuel that feeds cancer cells. Check out top 5 cancer-causing foods you should avoid, or 12 cancer-causing foods that you should not eat. Go ahead, click one, or better yet watch both and learn how to make your body less inhabitable for cancer. Do you know somebody affected by cancer? Let us know in the comments below.